Hey everyone, today we are treating a patient of mine who has been getting treatments for a few years now. And basically she kind of just gets like maintenance treatment done with dermal filler like once a year just to kind of touch up any kind of little shadowing or anything we see on the face. So for her, you can see obviously she's young, she has wonderful skin. And as I said, this is kind of a maintenance filler, so she doesn't need much. So you can see she's got really nice cheeks. At baseline, we did cheek filler on her a little over a year ago. So she's maintaining that filler really nicely, but she kind of wanted a little bit of volume in her under eye. She was noticing the darkness there and also just a little bit of hollowing in the tear trough. So I'm using a very light dermal filler, a little more superficial in this area and placing just a really tiny amount, just to kind of fill it in a little bit. When she smiles, which I may have her smile at some point throughout this video, her cheeks definitely are full, so I didn't want to add any real like fullness to the area. So I'm choosing not to do dermal filler deep in this area, to ensure that when she smiles, she doesn't look any fuller than she already does. Because sometimes too, then it just kind of creates like more of a tear trough or more of like a ledge in that area. So I'm filling in directly into the tear trough with a light filler. And you can see I'm using a cannula. So this is a Comfortox cannula. It is a 25 gauge, 50 millimeter length, attached right on the end of the dermal filler syringe and low and slow. So you can see I created a pilot hole after it was numbed with 2% lidocaine. And I'm just going in, keeping it pretty superficial, always using my other hand, my non-dominant hand, to check my tip and ensure I'm always over bone, always over the orbital rim in this area. You never want to go within that. And checking my depth as I kind of move along the tissue here. So you can see I kind of advance it, tent up, see what depth I'm at, advance it, tent up, and kind of do that the entire way. Before I deliver any product, I always do a good aspiration. Whether I'm using a cannula or a needle, I always aspirate. It just kind of gives me a little extra sense of safety there. So you can see I kind of pulled back aspiration, make sure I'm not getting any blood return, and then a low and slow pressure. You can also see that I'm retrograding and moving that cannula out as I am delivering the product, which basically is just helping with making sure I'm not leaving a bolus of product in any one area there. So I did one eye at a time. I started on her right side here because this side is more deficient. She sleeps on this side, so this side just seems to need a little bit more filler than the other side. So I always start on the more deficient side and then work my way towards the less deficient side just to ensure I have enough filler. So I'm using one syringe, about half the syringe per side, actually a little less than half the syringe per side. And I did the same exact thing on the other side. Here, I had her sit up and I used a marker to just kind of draw like where I felt like she needed a little bit of volume or where I saw shadowing. So I'm numbing again with just 2% plain lidocaine and then going in with a little bit more of a more medium light filler with a cannula to kind of fill in a little bit in the nasolabial fold. And then you'll see I kind of go down like towards the pre-gel sulcus area and then a little bit into like the oral commissure marionette line. I did all of it with cannula because I think that I find it easier and it's really nice for the patient to just have one insertion site. And then I can move the direction of the cannula kind of all over the face and reach a lot of areas through one insertion site. Using the same cannula, well, a new one, but the same kind of cannula, the Comfortox cannula. It's a 25 gauge, 50 millimeter length. I like it for filler. It's the cannula that I always reach for if I'm doing dermal filler. As you can see, just kind of going right up into the nasolabial fold. This patient in particular has had a lot of PDO threads throughout her aesthetic journey over the last 3 to 4 years. So she has a lot of nice collagen under her tissue, and she also has some scar tissue from threads as well. So it's a little difficult to get through with the cannula, but as long as you take your time, just you'll see I kind of do like a little bit of like twisting motion, and that helps. And then just also using my non-dominant hand as well to kind of hold the tissue and help get it through. Using the same technique that I used on the other side as well. So you can see like advancing it a little bit, checking my depth, advancing it a little bit, checking my depth. I'm obviously in like the subdermal plane in this area. So similar, same kind of plane you would be in if you were filling the nasolabial fold with a needle, but I'm just using a cannula. Still always aspirating, and then low and slow pressure and retrograding out. Again, not doing any bolus injections here. I'm just kind of doing a retrograde injection. Then you can see I changed my trajectory, and I'm going kind of into that like pre-gel sulcus marionette line area and just leaving a couple threads of filler here just to kind of help support that oral commissure. She notices the oral commissure kind of downturning a little bit. Of course, I have her laying back in this video, so it looks like she doesn't need filler at all. But I promise when she's sitting up, you can appreciate little downturned oral commissure and a little heaviness in the nasolabial fold. So that's kind of what I'm working on now. But you can definitely see that filling in these areas will help to define that a little bit more. And then just a little bit in that oral commissure there to support. Then I had a little bit of filler left, and I just kind of wanted some deep support in this like mid-face cheek area. So I switched to the needle that comes with the filler. It's a 27 gauge needle, 1/2 inch needle. And I'm just doing a couple standard cheek injections. So deep down to bone, making sure I'm aspirating, and then a bolus injection, no more than 0.1. This is kind of just in that like mid-face apex of the cheek area, just to give her a little bit of lift there and help support that nasolabial fold. And then I'm just using arnica gel. Obviously, I did the same thing on both sides. And I'm using the arnica gel to just go ahead and massage everything, make sure it all feels good, no major lumps or bumps. And you can see she looks pretty good. A little bit of swelling, nothing crazy. And she only has those couple insertion points because I used a cannula for everything except for the 2 cheek injections. And this patient is great. She tolerates procedures really well, so she's easy to work on. And I'll see her back in a couple weeks to see her final results. Thanks so much for watching, everyone.